Hello and welcome. My name is Fintan. I'm 64 years old. I work in healthcare and I believe in letting nature look after us in relation to our overall health. So today I want to talk about bursitis of the hip and how I overcame this problem using natural treatment. Bursitis of the hip affects millions of people, especially as they get older. The root cause is inflammation, but it can be treated and it may come back. So I'm going to cover the top 5 treatments for hip bursitis. People often ask me, can bursitis of the hip be prevented or avoided? The nature of hip bursitis makes it hard to avoid or even prevent. Our everyday activities mean that we are constantly using our hip, whether it is to sit down, to walk, to work or to run. Our hips are always being used. So if you like to exercise, always warm up before you exercise and remember to warm down afterwards. So what is hip bursitis? Well, the bursa is a sac-filled fluid. It works to cushion the effect of your bones clicking together. Bursitis of the hip occurs when the bursa becomes inflamed. The inflammation causes the swelling and pain. So by reducing the inflammation, you reduce the swelling and pain. What causes bursitis of the hip? Well, there are several causes, but obviously repetition, overuse of the hip joint, gout, a hip injury, diabetes, scoliosis or spine problems, differential leg lengths, bony growth or spurs on the top of the hip. Arthritis is a major cause of hip bursitis, especially rheumatoid arthritis. And in my case, wear and tear on the hip cartilage, where the cartilage wears away. That can cause hip bursitis, as can infection. So what are hip bursitis symptoms? Joint pain and tenderness, swelling and warmth around the affected area, hip pain when standing or walking, hip pain when sitting down, hip pain when sleeping, or hip and leg pain. As you can see here, we have a bursitis of the hip image. You can see the inflamed trochanteric bursae in the muscle and the femur. So that's where it all happens. So there are 2 types of bursitis of the hip. One is acute and the other is chronic bursitis. Acute bursitis normally flares up suddenly over hours or sometimes days. Chronic bursitis may last anywhere from a few days to a number of weeks. Chronic bursitis can stop and return again. Acute bursitis can turn into chronic if it returns or if there's an injury to the hip happens. So your doctor's examination. Your doctor will examine the hip area. He will twist your leg and hip for mobility, and he'll ask you about your symptoms and medications. He may send you for an X-ray or an MRI for confirmation of the diagnosis. So what are the best treatments for hip bursitis? Well, there are 5 options. Obviously, if you are active and your hip is being affected by your activities, it's desirable to take a rest. Your second choice is anti-inflammation drugs. But of course, with long-term use of drugs, there are a lot of side effects. Sometimes an ice pack can help. So if you try using an ice pack 3 to 4 times per day on the affected area. If your hip is chronic or acute, you may need to go for a hip injection. The trouble with this is that it only lasts for about 8 weeks and you have to go again. So the natural option that I recommend, because it worked for me, is serrapeptase. It's a natural enzyme. Why not try it? It worked for me. I had chronic hip bursitis pain for a long time until I discovered the amazing healing properties of serrapeptase. Serrapeptase is a natural enzyme. It comes in capsule form. All you have to do is take serrapeptase on an empty stomach. It will work by going after the inflammation first, and then it reduces inflammation naturally. As the inflammation reduces, there is a corresponding reduction in swelling and pain. Serrapeptase is safe to take with no side effects. Depending on the individual, it does take time to work. In my case, 5 months. I recommend the strongest dose for chronic inflammation, 250,000 international units. If you have been diagnosed with hip bursitis Why not try serrapeptase? I am confident that it will work to get rid of your hip pain for good. So for further information, please visit our website. Thank you.